Casey Mulligan Walsh always assumed she'd die young if her family's history was anything to go by. When she was 11, her father died of a heart attack at age 50. 10 months later, her 49-year-old mother died from breast cancer. And then when Walsh was a newlywed at age 20, her brother was also struck down by a heart attack. He was 27. However, an autopsy revealed that he had the arteries of an 80-year-old. Until then, Walsh hadn't paid too much attention to her health. So that's when she made an appointment for her first full adult physical exam.
And everything was great except my lipids, where my cholesterol was just crazy, out of control. So a typical LDL in a typical person should be under 100 is generally a safe level. I don't have my exact level then, but I do know when my cholesterol was at its worst, when I was untreated, my total was 450, so my LDL was in the 300s probably.
Walsh was diagnosed with familial hypercholesterolemia, or FH for short. It's a rare genetic disorder that affects 1 in 250 people and causes severe atherosclerosis, or hardening of the arteries, and early death if untreated. The problem is that an estimated 80% of people with this condition don't know they have it. That was the case for the Walsh family.
It's a genetic disorder. It's an autosomal dominant gene, which means that if you have it, all of your first-degree relatives, your siblings, your parents, your children, each of them has a 50% chance of having it as well. And in lay terms, the result of whichever mutation you have is that the liver does not function to remove the LDL or bad cholesterol from your bloodstream in the way that people who don't have this mutation are able to. In many cases, there's LDL receptors in your liver that kind of go out into the bloodstream and pull the LDL out of the bloodstream and rid it from the body. And in many cases, the mutation results in either those LDL receptors are absent, you don't have any at all, or the ones you have are broken.
As an ambassador for the Family Heart Foundation, Walsh hopes to increase awareness of FH. She writes about the effects of early childhood losses and the dangers of living with an undiagnosed genetic disorder in her memoir, The Full Catastrophe: All I Ever Wanted, Everything I Feared, which will be released in February 2025. After her diagnosis, Walsh was immediately put on bile acid-binding resin, a powder that gets mixed into water or soup. She says it was like drinking a cup of sand mixed with water. This was back in the 1980s, before statins were approved by the FDA.
Basically, every day you had to mix this orange stuff with water and drink this tall glass of glop that was just terrible. And I remember thinking back that I can't do this the rest of my life. Like every night I would go to bed like, oh, I just have to do this.
Now, in 2024, we have phenomenal medications that can treat this condition. Statins were first FDA approved in 1987. We know these are foundational medications to treat people with cholesterol disorders like FH, but we have additional medications today that are non-statins that are not only FDA approved, but we have evidence that these non-statins, many of them, can reduce the risk of heart attacks, strokes, and cardiovascular events.
That's Dr. Lawrence Sperling, Katz Professor in Preventative Cardiology and founder of the Center for Heart Disease Prevention at Emory University School of Medicine. He's also the new Chief Medical Officer of the Family Heart Foundation.
If we want to distill it down to just a basic concept, we have circulating particles of cholesterol in our blood. In a way, they are, we'll call them fat related. And we have a group of these particles that are the circulating particles in the blood that can build up on the walls of the arteries. In fact, they actually build up initially beneath the walls of the arteries. They incite inflammation, changes in the cells in the arteries, and over time, they can create a cascade leading to a buildup of fat in the arteries. We can call it that. You know, the initial pathologic lesion in atherosclerosis is actually called the fatty streak.
Statins and non-statins, called PCSK inhibitors, break down the plaque on artery walls by shrinking the cholesterol particles.
they shrink it, they heal it. And really our goal, first of all, our goal should be on the front end. That should be that if we catch somebody living with FH, familial hypercholesterolemia, at the earliest points in time when they're children, we may be able to prevent them from building up any cholesterol or fat in the walls of their arteries. But once that does begin to occur, what can happen is we shrink the plaque, we prevent it from growing, changing, or disrupting, and we heal it. And we have the capabilities today, even for people living with heart disease, but definitely for people at risk for heart disease, to prevent them from ever having overt problems.
When Walsh's first child was born, she wanted to know if he had inherited the FH gene. At age 2, she took him to the pediatrician to have his cholesterol levels checked.
A child's cholesterol is usually, even under 100, it's fairly low. Eric's at 2 years old was 298, his total. I'm not really sure what the LDL was, but you can extrapolate from that. It was high. My middle son does not have this, but my daughter's was 398 at 2 years old. So it's a very clear, my middle son clearly just does not have this gene. My pediatrician was more than happy to have him tested, but really didn't know what to do when the numbers came back like that. He quite possibly had other children in his practice with this, but it wasn't a common practice to test children then, so he wouldn't have known.
Today, the American Academy of Pediatrics recommends testing cholesterol levels of all children ages 9 through 11, and then again between the ages of 17 and 19.
Earlier, around the age of 2, if there's a family history of high cholesterol or early heart disease, and then, to think about, of course, checking cholesterols in teenagers. But coming back to children in our country, despite these national guidelines, only about 10% of all children are getting their cholesterol checked. And a major reason to have the cholesterol checked in children is to diagnose familial hypercholesterolemia, FH, at an early point in time, because we know the earlier this can be detected, the earlier it can be treated, we can change the trajectory of increased cardiovascular risk.
Sperling says that all adults over the age of 20 should have their cholesterol levels checked at least once every 5 years. Beyond that, he believes people should be aware of their extended family's health issues.
When I start seeing that pattern, early heart attack and death in a dad and a brother, and my antenna is up. And I think clinicians should have their antennas up. Frequently in young people, especially young women, even with that family history, they're told your cholesterol's high, so eat better and come back and see me next year. Well, of course, we do want to counsel everybody on healthy behavioral approaches, but the right answer is you likely have a genetic cholesterol problem. And in addition to eating better, there are medicines we can begin you on that are safe and effective that over time can lower your cholesterol, reduce your heart risk, and hopefully our goal together is that you won't continue your family tradition of deaths from heart disease at an early age.
Even though a healthy diet and exercise can't cure FH, Walsh says her condition would be a lot worse if she didn't eat right and get to the gym. Even though she's never experienced symptoms such as shortness of breath or heart palpitations, Walsh isn't tiptoeing through the tulips. Even so, when her primary care doctor suggested she get a cardiac calcium score, she wasn't prepared for the results.
I expected it to be good, and it was not good. It was, at that point, it was 90th percentile maybe for someone my age. But then these new drugs came out, which are miracle drugs for many of us with FH, the PCSK9 inhibitors. And I've been on PCSK9 inhibitors since early 2017. And my LDL is unbelievably good, where when I was taking statins and some other types of drugs, it helped that I was always compliant, but I could never get it into what we would call the safe zone.
Walsh has now been on PCSK inhibitors for about 8 years. So once again, when her doctor suggested another cardiac calcium score, she hoped the results would be better than the last time she took the test.
And it was not good. It was much worse than the earlier one. But things like that don't change your course of treatment unless you have symptoms. So I take aspirin every day. I take 3 medications. My LDL is really good. And all I can do is eat well and exercise and be compliant with the medication. I'm 20 years older than anyone in my family ever lived to. And that is absolutely due to the pharmacology.
Walsh is now 70 years old and celebrates every wrinkle with a grateful smile. Her book, The Full Catastrophe, is available for pre-order now. The Family Heart Foundation is offering free mailing kits to anyone who wants to check for FH. You can learn more about these kits by visiting our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.